What was your reaction to the decision of Metro Manila mayors? Are you in favor of this?
Good afternoon, Sean. That's a decision made by the mayors of Metro Manila. I remember a few months back that two pediatric associations told them, including the Philippine Pediatric Association, told them that the minors, basically those below 18 years old, may be carriers or potential carriers of COVID-19. No? And they were saying that since they are very strong, they have a strong immunity system, they could be asymptomatic carriers and could be spreading around the virus if they move around the area. No? And the other one is if they have a weak immune system and they could be potential strong victims of the COVID-19. So this is one way of prohibiting movement of people or lessening people moving around, at least in Metro Manila.
All right. So apart from that recommendation made by the Pediatric Society, do we have any other data showing that minors indeed significantly or at least in part contributed to the recent surge in cases?
Well, none yet, at least in the figures that we've got in the past 3 weeks, in this surge that has been happening. However, we got some data or information that the bulk of those who got COVID-19 infections were between 25 to 35, meaning those who have went out and started working in the workplaces and many offices. So again, this is the reason why we have to curb the movement of people, starting with the minors and most probably curbing the movement so that these people will be out of the streets after 10 o'clock. And this is the reason why we have the curfew.
All right, and of course we've spoken to several health experts also here on One News, and they recommend, practicing minimum health protocols even inside the household since transmissions within residences are on the uptick. Do you also adopt or recommend the same advice that health experts have given to at least mask up and practice social distancing even within the same household?
That's right. We recommended that even as early as last year, and we were last upon making those statements. Right now, it's the Philippine College of Physicians already made that recommendation that even wear face masks inside the house. And there are cases right now that the COVID-19 infections are now in clusters. In other words, in households of 5, 10, and 8, and families are being infected. So even in the household, especially if at least one or two members of the family are going out daily because of work, that they have to, when they enter the house, they must at least wear face masks to at least ensure that there won't be any infections inside the household.
All right, moving on to the implementation of curfew hours in the NCR. How are various areas in the metro doing so far? Of course, we know that 10,000 cops have been deployed, other uniformed personnel also. It is already day 2. How was yesterday or last night?
Yeah, we were monitoring last night's implementation of the first night of the curfew, and it seems that it has been working. That much of the people are now out after 10 o'clock, and hopefully we can sustain the same situation for the next 2 weeks.
All right, thank you so much for your time and your recommendations. That was DILG Undersecretary Epimaco Densing III.
Thank you, Sean.